Welcome, ladies and gentlemen, to sqadia.com. My name is Muhammad Osama, and today we are talking about data handling in medical statistics and research. And this topic that we're going to cover in this section is formal data monitoring. So, in this, we are going to talk about the DMC or Data Monitoring Committee. We're also going to talk about the functions of DMC, and we are also going to talk about the data quality issues and statistical analysis plan associated with formal data monitoring. So before we start off with DMC and its functions, first of all, we need to revisit what a randomized control trial is. So randomized control trial is usually used to find out the effectiveness of any prevention program or an intervention or drug or something like that, in which the sample is randomized and randomly allocated into two different groups, and one group receives the intervention and the second is the control, and we look for the effectiveness of that intervention or whatsoever. So studies such as randomized control trials, which are testing new treatments in patients, increasingly convene a formal data monitoring committee, also known as DMC. So these DMC are independent of the trial steering group. So what is a trial steering group? A trial steering group is actually the team of the researchers who are actually conducting that research, including the primary investigator and co-primary investigators and co-authors and statisticians as well. And this DMC is independent of that trial steering group, and it relates to safety and adverse effects and the continuation or early stopping of the trial. Now, what are the functions of data monitoring committee? So they monitor the safety of treatment under trial or under research in terms of adverse events. So if they see if any adverse event is occurring in response to that trial, they pinpoint that and they mention it and they inform the research steering committee about that adverse event. They also check for the evidence of clear superiority or inferiority of treatment. So if there's a clear superiority or a clear inferiority, they can tell the research steering group to stop the research because it has already been evident. They also monitor the recruitment rates, if they are fulfilling the requirement of that research statistically or not. They also monitor balance in key prognostic variables to check integrity of randomization process, such as if the key prognostic variables or key outcome variables are missing at baseline, so that actually remarkably affects the integrity of the randomization process. Or it can also be possible that some individuals with, you can say, favorable prognostic variables are in one group, and with poor prognostic variables are in the other group. So that also arises a question mark on the integrity of randomization process, and that is something that the DMC or Data Monitoring Committee vigorously monitors. They also monitor the adherence to the trial protocols by the researchers and the research steering group as well, that the researchers are actually adhering to the trial protocol that was decided at the level of the design of the research. The DMC also monitors the data collection, and they frequently do the data checks at different times in the research process as well. And they also focus on the trial conduct and the ethical concerns about the research as well, if they are being fulfilled or not. They also monitor the data accrual process, and they monitor the planned sample size calculations as well, because sometimes it happens that the values for standard deviations and means which were actually predicted at the level of the sample size calculation may change during the process of the research as you get more and more data, and that may signify that you may need greater or lesser sample, and that needs to be vigorously monitored, and that's the function of DMC as well. They also assess the importance of any new external evidence to the trial which may affect the findings of that study. And other functions of the DMC include reporting directly to the trial steering group and research trial steering group so that they can make specific changes based on their recommendations. So these recommendations are similar to the previous functions of the DMC, and they are actually the continuation of the trial in light of the observed adverse events. So in light of the observed adverse event, should the trial be continued or not? That is also a question. And continuation of the trial if clear superiority or inferiority is demonstrated. Sometimes if there is a clear superiority or inferiority, the research needs to be stopped. Moreover, continuation of the trial if a firm outcome is very unlikely given the data so far. So that is also, these are some of the things that if they are so obvious, then the research needs to be stopped because it has already made it clear that what the findings are or what the future findings would be if we keep on going on with the research process. They also report directly to the trial steering group regarding the issues relating to the data collection process or trial conduct in as much as it affects safety or assessment of the efficacy. For example, if the data collection process is poor and the DMC actually monitors and identifies it, they report it to the trial steering group to make changes regarding it. Otherwise, then the research can be in jeopardy. Now, constitution of the DMC, or the who are the participants or who are the individuals who actually make a DMC or who constitute the DMC. So the DMC usually comprises a small group of experts, at least one clinician with experience in that specialty on which the trial or the research is being conducted, and at least one statistician. But normally, typically, a data monitoring committee will have 2 to 3 clinicians and a statistician, and one of these will be the chair of the data monitoring committee or the group. The DMC meetings are attended by the trial statistician by agreement, and also by the principal investigator as well, so that they can be updated regarding any of the problems that have been identified by the data monitoring committee during their monitoring of the research process. Now, meetings of the DMC. The DMC usually meets at the outset of the trial and when the trial has been initiated and when it is starting, and at the pre-specified intervals during the research process, such as once a year for a lengthy trial. But it can be after a shorter duration, even if the duration of the research is short. At the meetings of the data monitoring committee, the data is discussed and they discuss the data which is provided by the trial statistician, by the research team which are actually collecting the data. So sometimes an analysis of the primary outcome is conducted at predetermined points to see if there's any reason to stop the trial. For example, if there is an obvious superiority of the new intervention at the predetermined point on the primary outcome, then there is no need to keep on collecting the data and continue the research process. So they can also stop the research at that point because the research has made its impact already. So there is a debate as to whether interim trial data should be provided with the treatment allocation revealed or whether they are presented blind, as for example, Group A and Group B. But in numerous cases, especially when we are talking about the adverse effects and things like that, sometimes it is important to identify the group, that which group is which, and the DMC should not be blinded. So in some trials, the DMC need to know which group in which is which to be able to determine the clinical importance of particular adverse events, as I already mentioned. And in other settings, the DMC or the data monitoring committee may agree that they do not require to have an unblinded data. It depends on the type of the research that is being conducted. However, in all cases, it is important that the trial team, including the primary investigator, remains blind to the locations while the trial is in progress, progress, because if the PI or the primary investigator is not blind to the research process and to the allocation of the participants in the research groups, then there can be a subject of bias, which is very important when we talk about RCTs and their quality. The exception to this is the trial statistician who conducts the data analysis and may need to be unblinded. So the statistician is the one person who can be unblinded, but the PI and the other team, they should be blinded for the research allocation of the participants. Now, what is the DMC charter? Now, it is different for different researches and for different data monitoring committees depending on the circumstances. But it is helpful for the DMC to drop a charter at the outset or the beginning of the trial to set out its precise and exact role and function, and how it's going to specify how the DMC will operate during the research process. So there are actually guidelines for the DMCs which provide helpful guidance on these issues, and how you can acquire actually a template for a charter, and how you can design a charter by yourself for a DMC for your research, or if you are one of the members of the data monitoring committee yourself. Now, data quality issues which are very explicitly and very aggressively monitored by the data monitoring committee. And in inspecting baseline and interim data, the DMC can highlight potential data quality problems, such as the completeness of the data indicated by totals less than maximum number of subjects. So if there is loss to follow up, why was there a loss to follow up? If there are missing values, why are there missing values? So things like that. So, and data quality as well, in the sense that if the data is entered in the correct form and the integrity of the data is good. Moreover, if you take an example of a cancer therapy trial, DMC noted missing data on lung function test at baseline. Now, this lung function test was an outcome variable. So if it is missing on the baseline, so how can we designate that how much improvement has been carried out in that individual or in that group? So this affects the ability to monitor adverse effects of treatment on the patients, as well as, for example, if we do not know that what was the lung function test at baseline, and if there was worsening of the lung function of that individual, the data monitoring committee cannot identify it, because they did not know the baseline lung function test values for that. So that is another important thing which the data monitoring committee has to keep a keen eye on, and that is one of the very important functions of it. Now, statistical analysis plan. So the trial steering group, in conjunction with the sponsor of the trial, is responsible for designing the trial, and therefore the statistical aspects, that what would be the key outcome variables and which type of test and which type of analysis they are going to perform on that data. But it is also very important that the data monitoring committee will often review the document before the trial starts and may give their suggestions regarding how to improve the statistical analysis of that given research. So that was all about this section of the lecture, and I hope you learned something new out of it. Keep on watching sqadia.com for more lectures like this. Thank you very much.